thank you for sharing. And let's get going and give you your treatment.
Okay, sounds good.
Ooh, tingles. And we're ready to go. So
Let's go.
first area that I treat is in the glabella. Okay, so the first shot is in the procerus. We go deep on the crease and we put 8 units in there. We go to the corrugators and we put another 8 units there. We go to the other corrugator right in the belly of the corrugator, kind of mid muscle, another 8 units there. And we go on the tail of the corrugator, squish, 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 and relax. And right there where the point of entry is right where the little apex is. And squish, squish, squish. You can see it here. The little squish, 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 relax and release. And actually, when she releases, the needle goes right into the skin. So how's that so far?
Totally fine.
Okay, so now the next step is bicularis oculi. Although Natalie has her headaches, her frontal. So therefore, I decide I am going to inject the bicularis muscle here. So just close your eyes tight, tight, tight. And we go up to the top crease, relax please. And just a little superficial, usually 4 or 5 units. Then at the lateral crease. And I go down a little bit through here. Now, if somebody has swelling underneath the eyes, I don't inject underneath here at this aspect. So it's so critical to people who get their migraines and it involves their vision or their eyes to do this bicularis. And actually, the neurologists are now doing a study to adjust the prevent protocol to include the bicularis muscle or the muscle that closes the eye. Yeah, the bicularis is a nice purse string muscle, like a C shape. It's all one here. Here is the depressor. So if we put Botox here, the frontalis lifts up. Yeah, it's pretty cool. Now, Natalie just looked up surprise. This is where people the prevent would do 20 units across here. So what I do is I actually go up into the scalp, because up in the scalp, the frontalis muscle is pushing down. So there's 2 parts of it, a lobe here and a lobe here. But there's also, and this is often not seen, is there's a frontalis here that's a depressor and a frontalis here that is the elevating muscle. So if you're putting all that 20 in the elevating muscle, that's why the brow gets heavy. So just turn this way. So I just do this, and this is all going into the depressor part of the, I'm going to use 30 units alongside the head here. Now I'm into the temporal area, and certainly the prevent really looks at the temporal nerve. And so we just do that there and a little bit back here. So I'm going to save 60 units for your back of your neck, and we'll do the rest just kind of different spots here for you. I'm just going to remove a little bit of the blood. One of the tricks to not get a heavy brow is I always wipe blood away from the brow. You push it down, the Botox may in fact get into the elevating muscles of the lid and then cause some lidtosis, just a heavy lid, which we never want to do. So this is looking really good. So the next thing I'm going to do is another layer up here. So we've got a layer here and a layer here. And then I'll just do a layer up above that, coming back. And then I also just do a little bit back here where her temporalis nerve is. And now I look up surprise. Natalie, it's your birthday. Lift up surprise again. I do just give a little tiniest bit here in the mid-frontalis to help to shape the brow, so the end result won't be some spocking and a nice, you can see now these brows are gorgeous and then really nice gulving to it. This Botox here will probably give her a little bit of a lift as well. This will give her a little bit of a lift. Lift up surprise, but so she doesn't look surprised too much. Just a subtle amount of Botox here helps to soften this frontalis area without really dampening it too much. So Natalie, we're going to get you to sit up and you're going to face the wall there. Just the visible prominence of the neck, and I'm actually quite spacing it out. Again, I space it out more than smaller amounts than what the prevent protocol calls for. And I find that that's such an important thing, because anybody has any degenerative neck disease, degenerative disc disease, and we take the muscle, the trapezius muscle, and weaken it too much, then they don't have the support, and then often they'll get some nerve root impingement. And the prevent protocol has been changed. They put a no-go zone here, where I actually like to still put a little bit all along through the neck, and we go and can you put this hand up? I'm going to try and just, you need to do just a little bit here in the upper trap. And then I go a little bit in the belly of the upper trapezius. We'll just do the other side. Just feel for the occipital prominence. Again, 2 or 3 units, really spread out. And those are my injections, about 2 to 3 units, not a bigger one. Sometimes the prevent's using larger amounts for each. And I just drive that in deep into the trapezius, and we're done. Again, I'm always wiping away from the eye because we do not. Right now, the Botox is still floating around in that intramuscular or extracellular space. And it takes a little bit of effort of the muscles to get it to actually go and lock into the receptor site where the Botox is actually going to relax the muscle. So squish and relax, squish and relax. Use your muscles of expression. This is going to help getting that Botox active and where it goes and into the cells. So, that's where we want it to go. And when you move your muscle, then there's stuff going in and out of the cells, and it takes the Botox in, and it sits on its little receptors, and away you go. And usually a couple of days, you're going to feel some improvement, but it's at 2 weeks when Botox reaches its full effect. And I usually, if I'm a first-time patient, I'll see them back at 2 weeks so that we can assess the cosmetic aspect of it. And I can see that the movement of the muscles that are treated have been affected, and that you should still look great. That's the key. We want people to look great and be pain-free.
That's how I feel.
Yeah.
That was so easy. Like, it's not a big deal at all. It's a walk in the park.